And joining us now to discuss a range of issues in the country's battle against the pandemic is Health Undersecretary Maria Rosario Vergere. Undersecretary, nice to see you again. Welcome to the program. Thanks for joining us today.
Yes, good afternoon, Carmina, and good afternoon to all of you.
Okay, let's first tackle the variant formerly known as the Kappa variant. How concerned is the DOH upon knowing that it has been detected in at least one case here in the country?
Yes, no. So, Carmina, this Kappa variant is the B.1.617.1. It is part of the family of the Delta variant. And according to the WHO classification, it is still a variant under monitoring, meaning it has still not it doesn't still have this significant effect on any population across the globe, but it is still under monitoring. So what we are doing right now is to monitor and also to further investigate the specific case that we have in the country, and we will be continuously doing our surveillance.
What do we know about the patient that carried this variant, Undersecretary?
Yes, the patient is a 32-year-old male, and apparently he has this, he is self-employed, he has his own office, and when he started having these symptoms for COVID-19, he isolated himself in that office with nobody with him. So he apparently, there were no contacts until he was extracted or sent to the isolation facility within the area, and now he is recovered. He just suffered mild symptoms of COVID-19, and right now we are further investigating and continuously monitoring this specific individual.
What are the possible reasons or for why he got infected? You said he was self-employed, self-contained, and yet he was infected by this subvariant of the Delta variant.
Yes, as far as we have as information right now, he doesn't have any history of travel abroad. Also, he is not he doesn't have that much travel across the country. So we are still further investigating, as I have said. But one thing that has to be noted, that this specific individual doesn't have any travel abroad at all.
But when you do read through various articles about this subvariant of the Delta variant, Dr. Vergere, it remains to be not as deadly, not as transmissible as the Delta variant. Am I correct?
Well, the characteristics of this variant is still being studied further. There are initial articles that are saying that it also possesses the characteristics of the Delta variant, wherein it is also transmissible, and also it has this immune escape mechanism, which the Delta variant also has. But as I've said, evidences and even experts are saying the studies are still not complete. That's why it was classified as a variant under monitoring.
Okay. And so far, when you did the contact tracing, he wasn't able to infect others.
Apparently, that was the report of our implementing unit. The specimen collected was late June, early June, June 2 of 2021 was when the specimen was collected. But the sequencing done was just last week because we were doing retrospective sampling. That's why when we have tried doing the surveillance already, our implementing unit said that they were able to do their contact tracing, and apparently not much contacts because he just stayed in his office during the time that he was symptomatic.
Doesn't that make you curious, Dr. Vergere, as to how could he have gotten infected?
Well, there would be other things that we need to consider and factors. Of course, he cannot just stay in his office the whole time. That's why we are redoing our surveillance. And also, we have instructed already our implementing unit to collect samples among the community within that specific area so that we can be able to see if there are other individuals affected by this variant.
All right, let's move on to another topic, another hot topic today, face shields. I mean, you've seen the report, you've seen the support, and you've also seen the resistance to it. What is the official line of the DOH regarding the mandatory use of face shields? Should it be scrapped?
Well, actually, Carmina, the appeal for the removal of face shields came in even 2 months ago.
Yeah.
When we were starting to do our shift in the policy and shifting into this alert level system, the appeal was there. Therefore, it was discussed in the IATF. Our experts weighed in on this, and we were able to revise the protocol that we just mandated face shields among areas which are included as part of the 3 Cs. And we just made it voluntary if it is outside of the 3 Cs. So that was the initial revision. Right now, there is another appeal because of the lowering of the alert levels, or transmission is lowering. So we just want to inform everybody that the science to the face shield is still there. We are going to revise if ever the IATF approves based on the recommendations of our experts, because of lowering transmission and not because it doesn't have any science at all.
Yeah, let's talk about the science, because various experts here and abroad have said that it is unlikely for you to get infected through the eyes.
Oh, well, that was part of the studies that we have evaluated. We have this consensus panel of experts, the Living Clinical Practice Guidelines experts, Living CPG, wherein they study all existing evidences both here and abroad. And according to their studies, although it was stated in one of the recommendations that the evidences are kind of weak, but still the benefit is there because it adds another layer. One of the studies that we have used when we recommended face shields was the study wherein it provides additional protection. But if you only wear mask, you're just going to get about 65 to 70% protection. You add face shields and you add physical distancing. The three of this would give you a total of more than 90% protection. So it's another layer. If you look at it, very simple. You just try to think about it. Having another form or layer on your face would prevent the droplets from landing on your face and your eyes, your nose, and your mouth. So it's another layer, and it is not really harmful if we can have another layer of protection. But of course, we understand the appeal of our local governments and the public. That's why our experts are already re-evaluating. We had an initial meeting yesterday, and we will be providing the recommendations on Thursday to the IATF.
Yeah, because when you talk about another layer, it's not just another layer of protection, it's also another layer of cost, especially for the poor who can't even afford to even think of what to eat next.
That's right, Carmina. That's why that's part of the considerations when we have discussed that yesterday with our experts. But of course, there would be areas or there would be situations that these face shields would still be mandated.
What do you say, though, to the proposal of using goggles instead?
Well, that's really something that our healthcare workers use for the longest time. Goggles are used in healthcare settings to protect your eyes from splashes.
But the proposal is not for the public to wear it.
No, we are not proposing that and not mandating that. Oh, but of course, that would always be an option. If the specific individual will opt to have or would opt to wear a goggle instead of the face shield because it's hot or they are inconvenienced by that, then they can do so. But it's not going to be mandated.
Yeah, because we also heard from Manila Mayor Isko Moreno saying, are you guys serious about this? Because that's even going to be even more expensive for the public to bear.
And we understand that. And that's why we said that we are never going to mandate that for the public, because we know the access to that would be impossible, especially for our common people. So we are not going to mandate that. It's just going to be part of those options. Maybe we can discuss that, because that's really how healthcare workers, no, that's what healthcare workers use in the hospital setting.
Undersecretary, here we are right now talking, and it's calm outside, relatively calmer than the previous times that we've been talking. But outside of the Philippines, in Europe in particular, they're experiencing another surge. And each time we talk about other countries, what they're experiencing is really portentous of what will happen here in the Philippines. We've seen it happen again and again. So the question now is, how do we prevent the surge that's happening in Europe right now from happening here in the country again? as we did see in the past?
Yes, Carmina, that's what we had been trying to advise the public from the start, that we have de-escalated the National Capital Region and the other areas of the country to alert level 2. That we are still not out of the woods, that the virus is still here. We cannot be complacent. We understand that people are so excited to go out already, but we still need to comply with the safety protocols. If you look at what's happening in Europe, mainly the increase in the number of cases came from their easing of restrictions.
Yeah.
They had easing of restrictions. They had this, the safety protocols were not there anymore. Most of the individuals were not wearing masks anymore, and therefore the cases increased. Here in the country, we are trying so hard to enforce the compliance to the safety protocols. We have our capacity that has been stated in the IATF resolution. For alert level 2, we can only accommodate 50% capacity indoors. But what we are seeing right now, establishments are allowing people, even though it is exceeding their capacity already. And we saw that in the videos and pictures over the weekend in malls and in other areas. So we are appealing to the owners of establishments. We are appealing to our local governments that we should be enforcing this kind of capacity limitations, because these are our safeguards, so that we don't experience again another increase in the number of cases.
Yeah, especially that the most vulnerable now are the kids, of course, the unvaccinated and the minors who have been allowed to go out.
Yes, ma'am. So as I've said, when we did our alert level system and we did this different interventions that we do, once we de-escalate to a lower level, there should be safeguards. So we can allow our minors, we can allow senior citizens, but the safeguards should be there. And the local governments, establishments, and of course, our public should be cooperative, so that we can be able to ensure that we can sustain this kind of low cases here in the country.
And also maybe Undersecretary, an appeal to the parents as well, because if they see that it's crowded already and they know that they have their minors with them, just not to push through anymore with a trip, even if they really want to bring out the kids.
That's right, Carmina. As I've said a while ago in one of my interviews, I guess one of the things that has been left unsaid or emphasized to the public would be mass gathering is still not allowed. So if you see that there is this place that you intend to visit and there is really crowding, please do not go anymore. Reschedule your visit, especially if you are with your kids, because the kids will be very vulnerable to having this disease because they are still not vaccinated. And especially also for the senior citizens, when you see that it is crowded, it is an enclosed space, please reschedule your visits to these establishments.
By the way, talking about pediatric patients, do we have any figures as to how many pediatric patients we have who have been infected by the virus, and how are they doing?
Here, I do not have the specific numbers, Carmina, but based from our recent analysis, the trends in the number of children getting infected with the virus is still the same, even though we had this uptick in cases last August and September. Yeah. We still have the older population having more infections rather than the children.
And are they able to pull through? What if they?
Yeah. We have very minimal deaths among our children. That's why when we were trying to prioritize who gets to be vaccinated first, the children were not part of the priorities, because according to our studies and analyses, that the children had the least number of infection and had the least number of deaths, meaning they are not that vulnerable to this disease.
But that still shouldn't be a reason for parents to just bring them out and be so irresponsible.
Of course, because we had been seeing also, and the parents has to be informed, we had been seeing children getting infected also and having severe disease. Although they are not plenty, it is not really significant compared to the other age groups in the population, but they are still affected. So our parents, guardians, should still be very careful. We should not be exposing our children to this kind of vulnerabilities.
Very quickly about booster shots, people have been having them, as you know, even without the guidelines coming from the government. First, can you define to us, Undersecretary, what is considered booster and what is considered like a full round, like the 2 jabs once again?
Yes, there are two types. This is the third dose and the booster shots. When you say it's a third dose, it means that a specific individual did not mount this adequate immune protection for himself. And this specifically happens to immunocompromised individuals wherein their immune system is not that robust compared to a healthy individual.
Okay.
Also, senior citizens, those in the older age brackets, may not be able to mount this kind of immune response as well. So you give them the third dose. There are existing vaccines already here in the country wherein we give third doses so that we can up their immune response, like the hepatitis vaccines.
Right.
Now, compared to booster doses, you give that because apparently the immunity that you have within your body has already waned, and you need the boosters to further up your immune response and have that full protection. So this is the difference between boosters and third doses.
The boosters, meaning you get 2 rounds of jabs again, depending on the brand, of course.
Looking at experiences across the globe, across the countries that are now implementing booster doses, they're just giving one shot after the first or the primary series of the vaccines.
All right. Okay. Now, almost 2 years into the pandemic, Undersecretary, and there is still a call for a better communication strategy coming from the DOH to address several things. We just talked about booster, but more importantly, vaccine hesitancy. So let me ask you, almost 2 years in, what has been the bottleneck? What has been the greatest challenge for the DOH, and why can't you seem to conquer it when it comes to communicating your strategy to the public?
Well, honestly, Carmina, in this time of the pandemic, we had been how do you say that? The main challenge for us is misinformation. We know that there are a lot of things, a lot of assumptions, a lot of perceptions, and social media is really being used by people, and they get it from there. And a lot of people got scared because of all of this misinformation about vaccines. So when we had our survey, the primary reasons why people still hesitate to get vaccinated would be that they are scared because it is not safe, they are scared because it's not going to be effective for them, and so on and so forth. So primarily, misinformation is really a challenge for government, for us to be able to penetrate. But right now, what we are doing, based on the surveys that we have, we're trying to address the issue, looking through these different factors that had been stated in the survey so that we can better address that, like intensifying our information, especially to those far areas where people really cannot be reached by this kind of social media and the other things. And the second would be mobilizing our local governments really for them to be able to encourage and convince their constituents. But the third, of course, we are looking at the spectrum of regulation. We are looking right now of the incentives and disincentives that we are trying to implement so that we can better encourage our citizens.
Yeah, which brings us to another controversial proposal here: no vaccine, no subsidy. People have called it anti-poor. Really, these subsidies have become the lifeline of the beneficiaries during this pandemic, and yet the proposal is to withhold it when they need it the most.
Carmina, we need to go back to the basic objective why there is this 4-piece program. The 4-piece program is the conditional cash transfer. When you say it's conditional, there are specific deliverables attached to that so that you can be able to get your subsidy. So this has been patterned with the different countries, from the different countries who are employing this so that they can get good health-seeking behavior, for example, for health. So in this 4-piece program, we have attached the different specific or critical programs for mothers and children,
right,
so that we can have that good health-seeking behavior. Now, if this will be proposed, definitely DOH would like to support that, because there would be the objective for having this good seeking behavior from people will be emphasized when we do that. But as we have said, we have to first review the legality of this, because this might violate the rights of specific individuals, and this might be contradictory to existing policies that we have. So this has to be further discussed, but if the legality and the existing policies had been managed and it's going to push through, DOH will support that, of course.
But people are calling this more of a punishment rather than an incentive.
It's not really punishment. As I've said, conditionality, it's a conditional cash transfer. This is for us, one of the ways for us to be able to encourage people to have this good health-seeking behavior, to have this kind of practice for health that will make their families healthy.
Yeah.
So it is not really punishment, but it's a way of motivating and incentivizing them to have this good health behavior.
But that's going to take quite a while, Undersecretary, because as things stand, it's not part of the law. You're going to have to rewrite it and amend it because it's not part of the conditionalities. Getting vaccinated for COVID. Go ahead.
Yes, precisely, Carmina. That's why we are saying if the legalities and all the existing policies can be aligned and we can be able to do that, and then we will support. But for now, that the existing policy and the law doesn't state that, and there are issues that might violate individuals' rights, and then we are not going to push for that.
Vaccine inequality and vaccine inequity. I mean, when you talk about vaccine and inequality, that could lead to inequity, further widening the gap between the rich and the poor. How concerned are you that this is happening as we speak? I mean, here we are, Undersecretary, Metro Manila doing well, but in the provinces, it's not a good picture at all.
Yes, very much concerned, of course. Equity would be one of the principles that the DOH would always position for. When we did our prioritization for these vaccination allocations, part of these discussions and part of the prioritization was geography. It was part that we have to be able to identify areas with highly burdened with COVID-19. That is why the National Capital Region was prioritized, because it was the epicenter and there was this increased burden of these COVID-19 cases. But afterwards, we started distributing to the other areas of the country. This is not really as much as or the factor in allocating. We have so much supplies already. One of the things that we are looking at right now would be the challenges in each specific setting in the local governments. Like in some local governments, there are a lot of far-flung areas. You have to cross using some other mode of transport like a boat. In other areas, they do not have any storage facility at all.
Yeah,
so
but Undersecretary, it's not as if we only know about this now. You had almost a year to plan for this.
Yes, we were able to deploy storage or refrigeration and freezers to these areas, critical areas. We were able to hire additional vaccinators to these specific areas. A lot of things had been done to augment the capacity of the different regions and local governments. But of course, we cannot say that we are perfect. There are still a lot of challenges that we are facing so that we can be able to at least close that gap between and among the different regions of the country.
And one of the main challenges, according to some, is really the leadership of the department. Undersecretary, yesterday, 2 former health secretaries said that the country needs a better leader for the health department, one that has a heart for the people and for the country, one who is competent and who is committed to the work and not to himself. How would you answer those?
We respect their opinion. We respect their recommendations. But it is always and still is the president who's going to appoint the secretary. Second, in any organization or institution, it is not just the leader that we look at. There is a whole set of cadre that will work and will provide the services needed by our Filipino people.
I'm going to have to leave it at that. DOH Undersecretary Maria Rosario Vergara, as always, thanks for your candor. Thanks for being with us this afternoon. Take care and you keep safe.
Thank you very much.